I thought I had my camera off. Hello, everyone. This is Dr. Marty Ross. I just realized that my camera is on and that you all probably can see me. So I was getting ready to turn it on. So hello. So I'm sorry to be running a few minutes late tonight. I got a little bit behind schedule here at my clinic, but I'm glad to help you out, and we'll spend about the next hour and a half together. So anyhow, yeah. So for those of you that are new here, welcome. And for those of you that are returning, I'm glad to see that you keep getting some value out of these webinars as well, too. The way that these webinars work, for those of you that are new, there's two ways you can participate. Number one, you can listen to questions as I read them and to the response that I give. There's always a lot of good education that can happen with that. And there may be things that apply to your situation as well, too. The other way is to go ahead and write a question to me. And you can do that by by going to the chat box down, I think it's on the right-hand side of your screen at the bottom, and write your question to me, okay? Realize with the chat box, anytime you send something, it goes to everyone, all right? So everyone else can see the questions as well, too. And so also I'd ask that you don't do crosstalk using the chat box with each other, because I want to keep it just for the questions, okay? All right. So I am creating a recording of tonight's webinar, and my intention is that I get it out to you somewhere around 9:30, 10 a.m. Pacific Standard Time, Seattle time tomorrow, okay? And so hopefully that goes as planned, and I can get that out to you. And one last thing. So as during the webinar, for those of you that are participating in the live version, you'll be able to see the screen. I post the questions on your screen, so you'll be able to follow along. But I will read the question. And the reason I read that question is people participating in the recorded version of it cannot see those questions, okay? So I want to read them out loud for everyone to have as some reference point as well, too, okay? All right, so, one last thing. So last week I was at a conference on dementia, actually a functional medicine conference on dementia, and got some very interesting insights out of that. But that's why I wasn't with you last week. I am here this week, and I will be with you next week. I haven't scheduled the ones for February yet, but I suspect I'll probably just continue without a break. So we'll go from January right into February as well, too. Okay. All right. So let me see here. Without any further ado, let's go ahead and get going. We'll take the first question here. All right, so this question is from Bill. Hello, Bill. Let's see. I have two questions. Can having the 3 Bs cause decreased kidney function? What would you recommend going forward? My last blood test, I had an elevated BUN of 25, an EGFR, which means estimated glomerular filtration rate, or the ability for the kidneys to filter, of 72, low globulin of 1.7, creatinine was normal range. My liver function is normal. In past tests, these areas have been normal. I'm taking the following recommended dosages: crypto, not weed, cat's claw, methylene blue, glutathione, baluchi, milk thistle, curcumin, resveratrol. Thanks as always for your time. All right. So, Bill, I get so there's 2 proteins that I like to look at that give me an indication of how the kidneys are doing. And the one that is most sensitive and most meaningful is creatinine. All right. So creatinine is a breakdown protein product that has to be peed out by the kidneys. If the kidneys are injured, creatinine will start to rise. BUN is another protein, but it is more related to your hydration status. So if, and what we usually will look at is if you have a BUN to creatinine ratio, so BUN divided by creatinine of more than 20, it usually is a sign of dehydration. So because I do not have your creatinine here, I can't tell from doing that calculation whether you're dehydrated, but I suspect that you might have been, given that you've had normal ones in the past too. Additionally, in my experience, the tick-borne infections do not alter kidney function. Some of the prescription antibiotics we use can. I have never seen any of the herbal antibiotics do it. Okay. I have seen both prescriptions elevate liver or hurt liver function at times. And also, rarely, I have seen that Borrelia can lead to liver inflammation, and that basically by treating Borrelia, the liver inflammation will go away. So for instance, in that situation, I had a person that developed marked AST and ALT elevations. I did testing to see if there was a virus that could be causing that. I got them off of any medications that could be causing it, and yet they still maintained very high AST, ALT elevations. And I started wondering, was this possibly a Borrelia hepatitis? It's not described in the science. No one describes this as being a regular thing, but I wondered. And what wound up happening is as we treated, the AST and ALT went down. I have seen it happen one other time as well too. So in terms of infections impacting the detox organs, I don't see it happening with kidney function, and I have not seen it happen with, or I have seen it happen with liver function though before. Okay, all right. Good luck to you, Bill. Hello, Eric. Let's see here. Let me post your question up. Hi, Dr. Ross. I have confirmed Babesia oticoli, Bartonella, and Borrelia T labs. I'm about a year into combination antimicrobial treatment, Malarone, azithromycin, rifampin. Previously, last spring, cinnamon, clove, oregano, doxycycline, fluconazole. Last summer, ceftonir, clarithromycin. Last fall, atovaquone, azithromycin, tetracycline. Zhang's allicin the last 3 months, along with biofilm agents, Lumbrokinase aqualorin, and binders due to ongoing mycotoxin positive all year. This has helped, but I'm still fairly sick. I wanted your thoughts on next steps, specifically whether a few months of itraconazole to address possible mold fungal colonization and give my system a break from antimicrobials makes sense before moving to methylene blue to phenequin, and how you weigh mold mycotoxins versus ongoing infection at this stage, not in mold exposure, but I fear colonization. I'd also appreciate your perspective on IV options such as Rocephin or IV azithromycin. Okay. So Eric, this is starting to get too complicated for me to be able to answer in this kind of a setting, because you're asking me to make a decision about considering what you've treated with before. I would need to know more about responses from before. I understand you're not getting all the way well. I need a lot more information to guide you on what to do next. That I can answer a little bit about Rocephin and azithromycin, but one thing I would suggest, Eric, so that I can give you better advice that I can't. I mean, there's just too much going on. I know from visiting with you before. I would suggest that you set up an educational consult visit with me where you and I can visit one-on-one. I'll show you where you can do that in a minute, but I can do that. I can give you input based on more information that I'll have you send me, and then I can make a more accurate discussion of what's the next steps for you here, because I can't tell just on what you've said here, okay? In terms of IV antibiotics, I generally am going to use those for Borrelia. I do not use them for Babesia. I just haven't found benefit from it. The situations I'll wind up using it in Borrelia is more or less if I've been treating somebody for a long period of time and they're not making vast improvement. Long period would be like even 6-9 months, and they're not making great improvements, I might consider doing IV antibiotics at that point. I have found that generally oral antibiotics will get the job done, and you don't have to take the risk financially and also systemically of doing IV antibiotics. Okay, that's just my how I go about it. Okay, all right. So let me just do a quick screen share here for you. All right, so this is my practice website, martyrossmd.com. And to look at the types of appointments I offer, you go to this appointments, click on that, and there's basically 2 sets of appointments I offer. I offer an educational medical consult, and then I also offer full medical service. For an educational medical consult, I do these as telemedicine, but because I don't get to see you and examine you, these visits are ones that I cannot prescribe, and I cannot make a formal diagnosis, and I cannot order tests, but I can tell you what I think you got, and I can tell you what I think I would do if you had those situations, okay? So this is a consult visit, and I can do this with anyone, no matter where they live. They can live anywhere in the world. They can live in the United States, okay? To do the full medical service visit, which is one where I can actually make a formal diagnosis using diagnostic codes, ICD codes, for instance. I can order tests, and I can actually be the prescriber of your medicines. That's a full medical service visit. This one, I require that people come to see me in my office to begin these types of treatments. And then for Washington State residents, I can do telemedicine afterwards. If you live outside Washington State, because I'm only licensed to practice medicine in Washington State, I cannot do a full medical service visit unless you do your follow-ups with me in person every 2 months, okay? So for those of you looking to figure out if you want to see me, those are the two classes of visits I offer. Read through here because I give a lot more information about cost, what to expect, forms you need to fill out, etc. It's all in these sections here. And then if you are interested, hit this book now button and you can set that up on your own, okay? All right. So for those of you, Eric, YouTube, but anyone that's interested, I do, because again, I just reopened my practice back towards the end of November. I still have space. I don't know how long that will last, but I still have space. So I'm open for appointments right now. Okay. All right. Good luck to you, Eric. Hello, Michael. Hi, Dr. Ross. Thank you for providing all this great information. I tested positive for Bartonella and equivocal for Lyme. I have had a swelling, burning sensation in my neck for the last 7 months and have been diagnosed with Hashimoto's thyroiditis by ultrasound and have anti-thyroglobulin levels, but normal TSH. Prior to the neck symptoms and Hashimoto's diagnosis, I have been supplementing with high-dose iodine, regrettable mistake. I don't know if the neck symptoms were triggered by the iodine or by Bartonella or both. I've been on an anti-inflammatory or AIP diet and your Bartonella herbal protocol for about 2 months without any improvement. How long should I continue the Bartonella protocol? Cryptolepis, Japanese knotweed, and cinnamon clove oregano. Could Bartonella have triggered the Hashimoto's and persistent neck swelling burning? I've started taking low-dose naltrexone and myo-inositol with selenium to try to lower my TGA-B levels. Would the peptide BPC 157 also be something too? And I assume, looks like the rest of your question got cut off here. All right, so So basically, in Hashimoto's thyroiditis, the body, the immune system starts attacking the thyroid gland, okay? And that's why you have the antibodies that are elevated. I have not seen it lead to burning sensations in the neck. I have seen it lead, Hashimoto's can sometimes cause swelling of the thyroid, so you get some enlargement here, but in terms of burning sensations, I have not seen that as a direct result of Bartonella, okay, of Hashimoto's thyroiditis, all right? In terms of and then regarding Bartonella, so it is possible that any of the tick-borne infections could have triggered an immune reaction against the thyroid. It is possible, all right? There's not hard science that shows that, but we often wonder that. So it is possible that as you start getting Bartonella under control, that over time you may have some improvements in the thyroid function as well too, and the inflammation there. All right. Now, Oh, and the one other comment then. So high dose, so iodine can be both helpful and harmful to the thyroid, all right? And generally, I recommend that people don't go over about 200 I believe it's 200 micrograms. Hold on here a minute. I'm going to look at it. I'm blanking off the top of my head here. So I'm going to do a screen share here. I'll show you what I want to look at here. I think it might be 500. Actually, bear with me here a minute. All right. So here's my article on thyroid, okay? And down here, I talk about iodine. I talk about a number of things you could do to help your thyroid work better, but let's talk about specifically about iodine. Okay. Oh, okay, yeah. So you don't want to use over 500 micrograms a day of iodine because it becomes toxic to the thyroid gland, okay? Now, when you do have a Hashimoto's thyroiditis, I like people to be on selenium, 200 micrograms a day. There is some science showing that it does benefit. I like people to get on low-dose naltrexone to help deal with some of the autoimmune components, so I'm glad to see that you're doing that. In addition, other things that help maintain healthy thyroid function are zinc, somewhere in the about 15 to 30 milligrams a day. Vitamin B3 or D3, I'm sorry, taking enough to keep your vitamin D levels in your blood, vitamin D3 levels, that is, at 50 to 80. Generally, for most parts of the country, that's going to be about 2,000 international units a day you want to get. Okay? All right. Let me go back here. All right. Let's see. In terms of the Bartonella, bear with me. I'm just trying to look back at some of your question here. So one other comment on neck symptoms. Burning sensations often means neuropathy or nerve injury. So regardless of where you have your burning sensations, if it's, I usually think of neuropathy, nerve injury, which can be part of Bartonella, okay? And I want to do things to help repair those nerves. And there's two things I like using. One is glutathione. Glutathione is an antioxidant that is made in every one of our cells. It's made in high amounts within the liver because the liver uses it to detox things too, okay? But in most of our cells, it's useful at repairing injury from the inside of those cells and also injury to your cell energy factories called mitochondria, okay? So part of nerve repair is glutathione. Second thing I like to do when people have neuropathy is I like to repair the membranes of the nerves. Your cell membranes are made up of a double layer of fats called phospholipids. They can get injured, leading to neuropathy as part of Bartonella. In addition, when you have the same things that are injuring your cell membranes may injure the coverings of your mitochondria, which are made up of similar fats. Mitochondria are the energy factories of your cells, and if they get injured, it's kind of hard for those cells to recover, okay? So when I see a burning pain, I'm wondering about neuropathy. And the approach I like using is to take a liposomal product of glutathione. Liposomal glutathione is better absorbed. Most glutathione is not well absorbed, but liposomal is. The product that I use, because it has good data showing absorption, good research showing it, is a product by Research Nutritionals called Try Fortify. And I like to have people take a teaspoonful one time a day of that to repair the phospholipid membranes and to give nutrients to your mitochondria, but also the phospholipid membranes of the nerve cells as well, too. I like using a product by Research Nutritionals called ATP 360. It is made up of phospholipid fats that could repair those, and it's got a number of micronutrients to help your mitochondria work better to power up your cells so they can heal, okay? And I would do that at 3 pills one time a day. So again, Try Fortify, glutathione, 1 teaspoon a day, and ATP 360, 3 pills one time a day are great supports for nerve neuropathy healing. Okay, all right. And so I find benefit by doing those. Okay, all right. And then let's see here. I haven't seen, well, Bartonella, as I said, could trigger autoimmune illness, including attacking of the thyroid gland as well too. Okay, all right. In terms of how long do we treat Bartonella, we treat till you get better. All right. An average treatment in 85% of people is going to be about 4 to 6 months. Generally, when I'm treating Bartonella, I'm trying to follow Bartonella symptoms to see if it's working. And so things that I call Bartonella symptoms are pain on the balls of the feet, neuropathy, but neuropathy sometimes can be Borrelia as well too, but neuropathy. Neuropsych issues. So Bartonella is known to cause a lot of neurologic agitation. So people can get depression, anxiety, they can have tremors or shakes, okay? Air hunger sometimes is a symptom of Bartonella as well too. And so I'm going to follow those symptoms and I'm going to see, are they getting better? And usually if you're on a regimen that's working, by about 2 months, sometimes 3 months, you should start seeing improvements in those Bartonella symptoms. If not, your protocol is not working, okay? And so I have no idea how long you've been on the crypto Japanese knotweed, cinnamon clove, oregano, but that's the kind of timeline I would use. And then if it is working, in about 85% of the time, 6 months, 4 to 6 months is all you need. There are 15% of people that this becomes a chronic, messy thing to treat. And I suppose that, and just by the nature of people being here, it's probably a lot of people that have not responded to that standard 6 weeks of treatment. Okay. All right. All right. Good luck to you, Michael. Hello, Sylvia. Hold on here just a minute. Dearest Marty. Oh, I like that. Thank you. I haven't been called dearest here before. That's really good. Dearest Marty, is IV iron infusion a good idea with Lyme, Bartonella, Babesia? My iron and ferritin are very low after a few months on antibiotics. It has now affected my hemoglobin levels too. I'm considering doing an IV iron for more effective replenish rather than oral supplements. Can this spark up Babesia or Bartonella symptoms? I've also seen artemisinin effectiveness may be decreased by iron and antioxidants. I need to address the anemia and then address the infections. Is this the right way to think about it? Okay. So I see no problem giving iron infusions. If you have not been able to raise your iron doing oral supplementation, or if your preferred way to raise iron is to do the infusions, I see no problem with that. The only problem I worry about is if you are getting iron, that somebody's following with labs to make sure you're not getting too much iron, because too much iron can become inflammatory. Okay, that would be the only concern I would have, but I assume they're going to be doing periodic iron measurements on you as well too, okay? You could actually address the anemia and iron deficiency as you treat your Bartonella and Babesia, I believe you wrote here. As you treat either one of those infections, you could be trying to improve your anemia using iron and infusions during that time, okay? All right, or at the same time, all right. Good luck to you, Zoe. Hello, Lee. Let's see. I was diagnosed with Lyme in 2020 by a local lab. Like many Lyme patients, I feel I contracted the disease much earlier than that. When it appeared, I did not respond favorably to the initial course of doxycycline. My primary care doctor insisted I find a Lyme specialist. She did a full tick panel for my genetics. The lab tested for several strains of Lyme, including Borrelia afzelli, the European strain of Lyme, which I tested positive for. 26 months after the initial diagnosis, a new Lyme specialist ordered a test from Vibrant. It confirmed positive for Borrelia afzelli. I asked several AI engines, what is the probability of contracting Borrelia afzelli in North America? The response was virtually zero, contracting the strain in North America. The last time I was in Europe was 2003. Since 2003, I have had to what appear to be major flu symptoms. Have I been carrying a strain of Lyme since 2003? All right. So probably not. I think AI is wrong here. Okay. All right. So, part of the problem, I mean, I like using AI, but you always got to go back and recheck. So there is some data on the East Coast of the United States. We are starting to see the spread of two strains of European type Borrelia. One is Borrelia afzelli, another one is Borrelia garinii, and we're actually seeing it extend even up into the New England states too. I don't have the study. I've looked at a study on this before. I can't tell you which one it is or where I found it, but it does appear to be that European Lyme has jumped the pond, if you will, and is sitting over here. So, maybe you got it in 2003 over there and you've been harboring it, or your immune system was doing a pretty good job of managing it since 2003 until you got sick. But it is also possible that either one of those strains are ones that you can get here in the US, in particular in the New England states. Okay. All right. Good luck to you, Lee. Thanks for raising that question. All right, let's see here. Hello, Gary. Let's see. I have a recent IGeneX positive for IgG for anaplasmosis, Bartonella genus, also Bartonella cantana. IgMs for all three were negative. I haven't been on antibiotics in quite some time for Lyme and co-infections, still suffering bad neurologic symptoms and inflammation. Went to dermatology for bad leaky rush on my head. After being put on Ceftonir for a week, I noticed my neuro symptoms subsided. Then back again after I stopped 7-day course of Ceftonir. Tested a 500 milligram azithromycin this week, and within an hour, near symptoms went away, neurologic, Lyme, or BART. Okay, so so thank you for your question, and then I'm going to make a few comments, and then I will answer it. But the few comments I'll make will be part of answering it. Okay. So first of all, so anaplasma is best treated with tetracyclines. Okay, and Ceftonir would not have any action against them. Additionally, Bartonella is best treated using intracellular antibiotics, and we do not think Ceftonir has any activity against them as well. Okay. Now, it is possible that being on Ceftonir may have helped you, because in addition to Ceftonir killing bacteria, not these, but not Anaplasma, not the two kinds of Bartonella, but in addition to it, it can kill like any kind of bacteria, not these that you have though. Ceftonir is also anti-inflammatory. So it can decrease cytokine-related inflammation. So it's possible that the benefit you had on the Ceftonir, noticing some improvement in symptoms, was helping to decrease some of the inflammation from whatever these infections are. Azithromycin, on the other hand, would be useful against both types of Bartonella. So Bartonella genus, Bartonella cantana. So cantana is a specific strain. The genus means you've reacted to one of many strains of Bartonella. Probably your genus is positive because you have tested positive for Bartonella cantana. Okay, all right. Azithromycin would not do anything for anaplasmosis. Usually we want to treat the anaplasma with either a doxy or a rifampin. Those are the ones that have got some science behind them showing benefit as well. Okay, so if you've been having a lot of neurologic symptoms and the azithromycin helped you, then it could be that you've got some active Bartonella again. And that would be, it's just a clue I would use. I would have to visit with you a bit more and ask you a bunch more questions to figure out if Bartonella is active or not. But this would be a clue that might suggest to me that, yeah, we've got some Bartonella activity going on. Okay. All right. Good luck to you, Gary. Hello, Cheryl. Let's see. Hi, Dr. Ross. I wanted to ask whether cholesterol is considered as effective as cholestyramine, particularly for binding purposes. I've been using cholesterol and have noticed a significant improvement, but I'm wondering how you view its effectiveness comparatively. So I consider cholesterol, which is also known as Welchol, and cholestyramine to be interchangeable. I think they can be both equally as effective. Okay? All right. Good luck to you. Hello, Rebecca. Let's see. Hi. How would you herbally treat chronic mono, Lyme, and Bartonella at the same time? What part of the day would you take Lumbrokinase and enzymes? My main symptoms are fatigue, muscle pain, lymph node pain, chronic sinus inflammation, ear ringing, and memory problems. Thank you. Let's see here. How would you herbally treat chronic mono, Lyme, and Bartonella at the same time? All right. So, mononucleosis is caused by a virus called the Epstein-Barr virus. If we were to poll 100 healthy people off the street and test them, and these are people that are healthy, we will find elevated antibodies against Epstein-Barr virus in maybe 5 to 10% of these people. In other words, and what that means is many of us cohabitate with Epstein-Barr. Our immune systems keep it under control. So regarding your chronic mono, it may not be a problem. And in general, at the beginning of treatments, I don't usually do anything about elevated antibodies against an Epstein-Barr. It is possible, though, that as a result of having tick-borne infections, that the immune system gets preoccupied dealing with them, and then you might see situations where mono gets active. But what I have found in those situations is rather than putting you on something to kill the mono directly, usually what I find is that taking the steps involving the whole Ross support protocol, like getting sleep, lowering cytokines, doing basic detox steps, having movement, getting your yeast under control, killing your tick-borne infections, adjusting your thyroid, adjusting your adrenal, doing all those steps of my treatment protocol, because it's designed to not just kill your tick-borne infections, it's designed to support your immune system. Doing all those steps will allow the mono, if it has gotten active, to get under control. Okay? So your approach to getting the mono under control is to follow the steps of the Ross support protocol, and I'll show that to you. All right. In addition, in that protocol, you would want to follow steps that will allow you to start killing Lyme and Bartonella. The way I prefer to do that, if you're working herbally, and that's usually where I'll start people, is herbal these days. The reason I like working with herbal antibiotics is they often will work quite well. Secondly, they keep you from harming your gut, your microbiome in your gut, okay? And so a regimen I like that will go after both Bartonella and Lyme at the same time and will treat for both growing and hibernating, or we call persister forms of Lyme and Bartonella, would involve using Cryptolepis, Japanese knotweed, and liposomal cinnamon clove oregano capsules, okay? The Cryptolepis for Bartonella and Lyme, I like to dose at a half teaspoonful 3 times a day. It's a pretty high dose, but I go higher if there's Babesia involved. But for those two, I would do half a teaspoonful 3 times a day. Japanese knotweed, I would do a 5-to-1 tincture, meaning it's a tincture that's created. Actually, Cryptolepis is a 5-to-1 tincture too. So 5-to-1 tincture means that when they created the alcohol tincture, that they took 5 parts of alcohol and 1 part plant, and they put those two together, and that alcohol extracts the good ingredients. Okay, all right. And the brand I like for both of those is a Montana Pharmacy product, just because I like the quality. I think I've seen really good outcomes for it in most people. Okay. All right. Then, and so in terms of Japanese knotweed, you'd want to do 30 drops twice a day. I like using liposomal cinnamon clove oregano because it also treats growing and persisters, but there's data that came out of Johns Hopkins University a number of years ago that shows it can break apart biofilm slime layers that cover the germs, all right? And once a person is stable on that, then I might add in lumbrokinase. The reason I work with lumbrokinase here is it can help with biofilm, but also we think that Bartonella has the ability to wrap itself up in blood clotting protein called fibrin, and it could create these germ fibrin nests that then stick on your blood vessel wall where they kind of hide away from your immune system and hide away from the antibiotics, all right? In terms of when you want to take the lumbrokinase, it's depends on when you can squeeze it in your day. You could do morning or night. The main thing about it is you want to take it on an empty stomach without any other medicines or supplements or food, so that it is not used to digest them, but rather it's absorbed to digest your fibrin. Okay. All right. And so I usually tell people to avoid taking any medicine, supplements, or food beginning 1 hour before they take their lumbrokinase. And then they can resume taking all those things up to beginning 1 hour afterwards. It's okay to drink water with your lumbrokinase. All right. That's what I would do. Let me do a quick screen share here. I want to show you a few things. Let's see here. All right. All right. So we're back at my Treat Lyme by Marty Ross MD site. Okay. Here is my Ross protocol. And all of these steps are designed to help get your immune system working. And then ultimately, there's parts here that involve killing germs, okay? So there is a part to my protocol that deals with getting sleep. Sleep is helpful to turn your immune system on. It also decreases inflammatory cytokines. There is a section on the diet that I recommend, which tends to be an anti-inflammatory diet. I talk about the importance of maintaining a healthy microbiome. The reason you want to maintain a healthy microbiome is that it helps decrease inflammation. And the microbiome, we increasingly understand, is the brain of your brain, the brain of your heart, the brain of your gut, the brain of your immune system. So we want to do as much as we can to help maintain the healthy intestinal microbiome. I talk about the role of exercise, a type of exercise that you can do. I understand no one, when they first get their illness, is going to be out running the marathon, for instance, but there are some basic exercises you can do. It's important to help your immune system work better, to get viruses and Lyme under control, to lower inflammation cytokines. It's important to support your adrenal and thyroid glands with an adaptogen. If you do actually have low thyroid or low adrenals, it's important to manage those to help your immune system work well. I talk about the need for a good multivitamin. I talk about basic steps for detox. I have a section on immune system boosters, but actually the whole protocol up to this point is designed to boost your immune system. If you have intestinal yeast, it's good to get those out. And then here in my Lyme section, if you go all the way down to this option 3, Babesia, Bartonella, and Borrelia treatment at the same time. This is where I describe the 3 herbs: the crypto, Japanese knotweed, the cinnamon clove, oregano. Here, the dose, 1 teaspoon 3 times a day, is actually more if you have Babesia. If you don't have Babesia, you can do 2.5 milliliters, which is a half teaspoon, 3 times a day. Okay, all right. And then in terms of the products I recommend, if you're ever wondering, what does Marty recommend? So for Cryptolepis, well, actually, let's do Japanese knotweed. Japanese knotweed. There it is. Okay. And so this is my Japanese knotweed product I recommend. And I guess that's opening a little slowly here today. Well, that's not good. Anyhow, that's my Japanese knotweed product. Okay. I have to come back and look at that later as to why it's not working. Here, let's try a different way. There we go. So the tinctures I generally recommend are all made by Montana Pharmacy. Okay. And this is the Japanese knotweed one that I was telling you about. Okay. All right. Go back here. Oh, there we are. Okay, got it. All right. Good luck to you, Rebecca. Hello, Suzanne. Let's see. Thank you, Marty. You're welcome. Does high-dose thyroglobulin antibodies from Lyme or co-infections? As we were talking about earlier, in any of the autoimmune thyroid illnesses, it is possible that Lyme and or any of the co-infections could trigger an autoimmune reaction against your thyroid. Okay. All right. Hello, Cindy. Let's see. Is the Bartonella FISH test of any value? Thanks. So yes, it is. But let me just talk about that a little bit more. So to do this discussion, I want to talk about two things: testing in general. Okay. So when we do testing for any of the tick-borne infections, there's two families of testing we can do. We can do what is known as a direct test, or we can do indirect testing. All right. Direct test would be methods where we actually can see it under the microscope, or we can measure the genetic material, the DNA of it, okay? That's direct testing. Or we can do a culture, which is practically impossible with tick-borne infection, but we could do a culture. So culturing is a direct test. A microscope exam is a direct test. And PCR DNA quantification of the germ is another direct test, okay? One type of microscope exam for Bartonella direct test is called a FISH test. FISH stands for fluorescent in situ hybridization. And there is one that is being done, offered by IGeneX. And there's a newer lab out there called T Labs that is essentially doing a FISH test. They just don't call it a FISH test, but it is a microscopic exam. In a FISH test, we take a probe that will attach to the genetic material of the germ, and then it helps us, it lights up, it has some fluorescent qualities so we can see it better. So IGeneX does one called a Bartonella FISH test. T Labs, all of their testing are FISH tests, okay? They don't call them FISH tests, but it's essentially what they are, okay? All right, so there's direct testing, all right? Indirect testing is we're looking to see, is there an immune reaction that has taken place that can suggest the immune system has tried fighting this germ, which can suggest that you've had or still might have the infection in you, okay? So the most common indirect test is an antibody test. And antibody testing will go by the name IFA, that's an antibody test. Immunoblot, like IGeneX does, is an antibody test. Western blot is an antibody test, all right? The other way to do an indirect test is to do something called an elispot, which is also known as a T cell reactive test. So T cells are your white blood cells that can attack germs. And we can measure, and so your T cells, we can measure in the lab if your T cells react against Lyme or Bartonella or Babesia or Anaplasma proteins. The way the test is done is we draw your blood, we take your white blood cells, put them in a test tube, and we take some proteins from the germ we're testing for. So we take Bartonella proteins, we put them in the test tube, and then we measure certain types of cytokines that your white blood cells will make if they have tried to attack that germ. Now, what's interesting about doing the ELISpot is that an ELISpot is interesting because your T cells circulate for about 2 months. Majority of your T cells, not all of them, but the majority of T cells, your circulating T cells, will be replaced every 2 months. So you can make an argument that if your ELISpot is positive, it means that sometime within the last 2 months, your body has tried to attack one of those germs, all right? So compared to an antibody test where we really can't tell by looking, have you responded recently, you could make the argument with an ELISpot test that your body has recently tried to attack it. Therefore, there's a chance it may still be in you. Okay, now, when it comes to testing, we recognize something called sensitivity and specificity. Sensitivity is the ability of a test to find what they're looking for, okay? So with the immunoblots that are done through IGeneX, we recognize that they have about a 94% sensitivity. We know that because IGeneX did validation studies where they looked to see how accurate is their test at finding these infections when they're there, all right? The major company that does Infecto Lab Americas and Armin Labs are the two companies that offer ELISpot testing. Neither of those labs has done their own validation studies to tell us what the sensitivity is of their test. But in general, data on ELISpot testing in general says that ELISpot testing will find infections if they're there about 15% of the time, okay? So in terms of sensitivity, your immunoblots through IGeneX are better than ELISpots. There's an additional problem with ELISpots versus immunoblots. So the immunoblots through IGeneX, which is again indirect testing, are designed to test for any member of the Babesia family and any member of the Bartonella family, as well as 8 different Borrelia strains. ELISpot testing through Armin will only look at 3 strains of Borrelia, meaning they may miss 5 strains, and they only look at Babesia microti. I believe they may do Tick-Borne, but they're missing the additional Babesia strains. And their Bartonella test only looks at Bartonella henselae, and we think there may be 15 strains of Bartonella. I could make similar comments for Infecto Lab. So I know a lot of my provider colleagues out there like relying on ELISpots to tell them whether a germ is still effective, but it's going to be wrong 15% of the time, and it may not be testing for all the different strains that can infect a person, okay? So of the indirect testing, immunoblots are the best, and the immunoblots offered through IGeneX are the best, okay? All right. Now, it is true that Vibrant Labs is also offering antibody testing, but Vibrant Labs has only done testing to show how accurate. They've only adequately validated their Borrelia test. They have not adequately validated their Bartonella Babesia test, so I find them untrustworthy. The problem is Vibrant has done a great job marketing to all the naturopaths and the integrative medicine doctors out there who are doing the testing, but they're not aware that Vibrant has not done adequate validation on those tests, right? They're also offering them because they're cheaper than IGeneX, but you get what you pay for. They're just not accurate. And I whenever anyone comes to see me with Vibrant tests, I only use the Borrelia component. I don't care what their Bartonella or Babesia test says because I can't trust it. So I will go back and repeat my testing through IGeneX typically. Okay, all right. That's on the indirect side, okay? So on the indirect side, again, immunoblots through IGeneX will find it 94% of the time. And on the ELISpot testing, none of the labs have done validation studies, but we know that in general, ELISpots will only find something 85% of the time it's there, all right? All right, now, direct testing. No lab, even IGeneX, T-Labs, none of them have done any validation studies to tell us how sensitive their tests are. We really don't know. I could make an argument that for Borrelia and Bartonella, because they don't live in the blood, they tend to live inside cells or deep in your tissues, that it is possible that maybe there's low sensitivity on those tests, okay? The problem is it has to be in the blood sample you draw to see it under the microscope. And if something doesn't readily live in the blood, like Bartonella and like Borrelia, it just may not show up. In other words, having a negative direct test does not prove you don't have the infection. Having a positive direct test does mean you have it, okay? All right. All right. And then But if you do get a positive direct test, it's very specific. It does mean you got it. Okay. So I tend not to use, I know the current fad is to do a lot of T-lab testing because T-lab might can see it. But again, negative testing on T-lab, negative testing on Bartonella or Babesia FISH testing through IGeneX does not prove you don't have those infections. Okay. All right. Oh, I know it is. One more thing. It is possible that with Babesia does live in the blood. So Babesia may have more sensitivity on a FISH test or a PCR test, for instance, than what these other methods do. Okay. All right. Good luck, Cindy. I know that's very long-winded, but I had to go through all the testing options to answer that. Okay. Good luck to you. Oh, so I explained this a bit more. If you're interested in looking at an article that I have about it, there's an article I have called Best Test, somewhere here. This one right here. The best lab and test for Borrelia, Bartonella, and Babesia. And in here, I make the case as to why the immunoblots from IGeneX are best. Okay? All right. Hello, Bill. Let's see. What do you do with patients who refuse any conventional pharmaceutical or over the counter meds and want to treat their Borrelia solely naturally? So, if I kind of reviewed that earlier tonight, I would use the combination I showed you in my protocol earlier, but again, I would use a combination of cryptolepis um, and Japanese knotweed and liposomal cinnamon clove oregano capsules. Okay. If you're just listening for your specific part of the question, or participate, I hope you saw. Pay attention to the part of the webinar from earlier tonight where I showed you my protocol, but I also described how I use the cinnamon clove oregano, cryptolepis, Japanese knotweed. Okay, all right. Good luck to you, Bill. Hello, Leslie. Let's see. Hi, Dr. Ross. I'm wondering if you think liver flushes are beneficial. And if not, might one do to help an overburdened liver? My past history includes decades of mold exposure, Lyme and co-infections, COVID, hepatitis C. Many thanks for all you do. So, I don't think liver flushes actually work. I know that there are certain mixes that involve olive oil and other things you can do. And then people will release these, what will come out in the stool are things that look like stones. But what they really are is just cholesterol fat deposits that happen to solidify. Okay. All right. And so I don't think there is something that such as a liver flush that works. What I like to do is to support liver function. And what is one of the best agents to support liver function is glutathione. There's two ways you can do it. One is to take micronutrients that help lead to improved glutathione production. And two of the micronutrients you could use are N-acetylcysteine, also known as NAC, 500 milligrams 2 or 3 times a day. And you could do that alone, or you could pair it with alpha lipoic acid, about 300 milligrams twice a day. The NAC is converted directly into glutathione. The alpha lipoic acid is an antioxidant that helps improve the production of glutathione, but it's not actually one of the building blocks. But those two together can do a good job, okay? Or just take glutathione. But you want to make sure if you're doing glutathione that you use a product that has been validated to be well absorbed, because there's a lot of garbage out there. And so the product I like, because they validated that it's well absorbed, is Research Nutritionals has a product called Trifortify, which is a form of liposomal glutathione. Okay? All right. Good luck to you. All right, let's see here. Hello, Angie. Let's see. Thank you for all you do for us. You're welcome. Have you ever tried a GLP-1 or 2 for anyone with Mast Cell Activation Syndrome that has tried all natural and prescription options but couldn't tolerate any? I see some research out for GLPs for mast cell activation as well as inflammation. I haven't seen any data showing usefulness in mast cell activation. There is some data showing that the GLP-1s may help with inflammation. It's hard to tell, though, if it's due to anything dealing with infection inflammation. So keep in mind that when people have either flat out diabetes, which means fasting blood sugars over 125, or hemoglobin A1C measurements of 6.5 or higher, that having diabetes is inflammatory. It's just an inflammatory condition, right? So, and then also there's better data showing that when people have prediabetes, and prediabetes is defined as fasting blood sugars over 100 but less than 125, hemoglobin A1Cs between 5.5 and 6.5, I believe. That's prediabetes, but even that's inflammatory. And there's even other data out there suggesting in 2 different studies that if you get, I think there was a Kaiser study and a separate one that shows that if you have fasting blood sugar levels over 84, I think it's 84 or 86, that for each 1% each 1 point increase over 84, you have a 6% chance of developing full-on diabetes eventually, okay? So for instance, if you have a 94, which is 10 points over 84, you would have a 60% chance of going on to develop full-on diabetes, all right? And there's some data out there that suggests that you have inflammation starting to occur and injury starting to occur to your blood vessels when you have fasting blood sugars over 90. All right. So the reason I'm letting you know that is not to scare anyone, but I want to let you know that when we see studies that say the GLP-1s may be useful at helping inflammation, maybe that is due, and I'd have to look at the individual study, okay, but it may be due just to getting prediabetes and even diabetes under control, because lowering your sugars and losing body weight, especially in people that are overweight, helps decrease inflammation in the body. All right. I have not seen any data on MCAS. I do know that there was one of the sessions at ILADS, the annual meeting in November. I think it was Dr. Dempsey talked about using GLP-1s at very low doses. I think she was talking about it more as anti-inflammatory. I do not believe she talked about mast cell activation with that. So I just haven't seen. It's an interesting question, but that would be the point I would make with that. In terms of mast cell activation, and you quote unquote have tried everything, keep in mind some things that you might still try. One is low-dose naltrexone, which is a drug, but it's an extremely low drug. It's a narcotic blocker. Binds to an area on your mast cells called toll receptors, and it can help stabilize the mast cell. It makes it so it's less reactive and less likely to release histamines. I often find in my practice that people that cannot tolerate any medications, whether it's the Zyrtex or it is quercetin, which is an herbal medicine to stabilize mast cells, often they can tolerate low-dose naltrexone. Okay, so that's one thing to keep in mind. The other thing that can be helpful sometimes is to be on a peptide product called KPV. Keep in mind, if you try KPV, the only difficulty I see with it sometimes is it is possible KPV has some antimicrobial properties, and so you could trigger possibly trigger a Herxheimer reaction, but often people can tolerate the KPV. And sensitive people, I would start at maybe a half a pill once a day, and you try to work up to 1 pill twice a day on that. Okay. All right. The latest thing I like using with people, and you maybe putting this in a drug category, is a medication called ketotifen. And ketotifen has two properties. It's a good mast cell stabilizer, and it's also an antihistamine H1 blocker. It has to be made by a compounding pharmacy because the pharmaceutical manufacturers only make it as an eye drop. All right, so it has to be converted into a pill form. And you would want to start at about 1 milligram, and you can work up to twice a day on that. And that often can be tolerated too. Okay. Finally, I'll show you my article on mast cell activation here in a minute. But the other thing to keep in mind when people are really, really sensitive, it's not always just a mast cell activation problem. It can also be a limbic system activation problem within the brain. So the limbic system is a part of your brain that governs your fight or flight response, your sympathetic and parasympathetic adrenaline nervous system. It governs reproduction. It decides if we're hungry or not. It's kind of an autopilot area of the brain. And one thing that can happen when you get into chronic tick-borne infections or in mast cell activation syndrome or in mold toxicity, this part of the brain gets turned into an on position. And therefore, it is much more sensitive to any abnormal sensation you might feel in your body, suddenly triggering a whole reaction. Okay, all right. So you can retrain that area of your brain. And there's a number of systems out there, but I'm starting to lean more towards the Gupta Program, Gupta. The reason I'm leaning more towards the Gupta Program is they've got university-based research showing benefit. And at the conference I was at down in Florida this last week, I actually saw Gupta present. It was pretty impressive. The data would suggest that people can have symptom improvements of about 40 to 50% across the board in chronic fatigue, fibromyalgia. I think his Lyme data was even better than that. It was like 80 or 90%. Okay. That's just by retraining your brain. If we don't have a drug that has that much potential of helping a person. And after seeing, I in the past was more or less recommending a Gupta program for my patients. If they had done years of treatment and hadn't gotten better, I might consider doing it then. I definitely would consider doing it in people that have mast cell activation because of the reactivity component there. But I'm beginning to think about anyone that comes in to see me that has had symptoms for a year or more. I might recommend they try Gupta too. The data he showed was really pretty impressive at the degree of improvements people have. Okay, so that's something to think about. Other ways you can retrain the limbic system, there's something called Primal Trust, and there's another program out there called Annie Hopper DNRS training. But I don't think any of them have the data, and I was impressed. I was just impressed by the data I saw in the Gupta program. Okay, all right. So let me do a quick screen share here for you. All right, so in terms of mast cell activation, take a look in my immune system section here. And I have two things you can look at. You can look at my video guide, okay? You can also read this article here. And then I recently put together on how do you manage extreme sensitivity, which is basically deal with mast cell activation and deal with limbic system. Do the limbic system retraining. So these are 3 articles that you might find helpful for yourself. Okay. All right. Oh, one last thing in terms of the KPV, if you're not familiar with it. So this is KPV. This is manufactured by Integrated Peptides. This is the peptide product peptide I was talking about. Or the peptide I was talking about, KPV, is found within this product. Okay. All right. I guess I didn't do a screen share there. Let me try that again. All right. Anyhow, this is KPV. Okay. And you can find this here at my store. Okay. All right. Good luck to you, Angie. Hello, Lisa. Let's see. If you've had both Lyme Borrelia and long COVID for over 4 years now and feel the neurological Lyme problems in the eye and elsewhere are worsening, would the LL37 peptide be worth trying? I've been on an herbal protocol for over 3 years already. And what about trying the antibiotic minocycline? So regarding the LL37 peptide, it can be antimicrobial. I have no practical experience working with it to know if the claims of it making benefit actually do. And I will tell you with any of the peptides, even though I do work with them, our scientific base of work of it helping in situations like tick-borne illness just doesn't exist. We just don't know. Okay. All right. So I can't answer that one. I don't have a practical base of knowledge to discuss that with you. Okay. And then minocycline is a tetracycline. So doxycycline is one, minocycline is one. Minocycline may have one more advantage over the doxycycline in that it's fat soluble and can cross over what we call the blood-brain barrier. Okay, it can get into the nervous system a little bit easier. Having said that, when you look at studies about doxycycline's ability to penetrate the nervous system, it can do a good job too. Okay, all right. So could it help? It might. Okay, all right. Good luck to you, Lisa. Hello, Sally. Let's see. Hi, Dr. Ross. What are your thoughts regarding IP6 Gold supplement? I hear it can relieve pain and remove excess iron from the body. I don't have a thought on it. I'm not familiar with the product. Okay. Sorry about that, Sally. Good luck. Hello, Eloise. Let's see. What are your thoughts or experience with Dapsone therapy, especially low dose for children? Thank you. So it's a difficult topic. I mean, it's a complicated topic. Let me describe that. So Dapsone is an antibiotic that has been used to treat intracellular infections and was discovered by a physician named Horowitz to be helpful initially in a patient he had that was having difficulty. Okay. Since discovering that Dapsone helped one of his patients, he's become a major proponent and I will say cheerleader of his therapy, but it's questionable some of the outcomes he purports. All right. Now, I'm sorry, Horowitz, he's a good guy. I mean, he's helped a lot of people, but there's some issues that I have. Okay. So first of all, and so Horowitz came up with Dapsone protocols. All right. Initially, we have to look at his initial study. His initial study was done using doses of 100 milligrams or less a day. And based on this one study, then he started trying to modify and go into higher and higher doses. All right. So on his initial study that included people that did not respond and did respond, using up to 100 milligrams a day, he found that 54% of people had to drop out of the study because they couldn't tolerate the side effects. Okay. And that's significant. 54%. So the symptoms that you can get with Dapsone are, these are side effects. You can get muscle pain and fatigue. Well, that sounds just like Lyme disease, doesn't it? So anyhow, you have a lot of people that can't tolerate it. And so you wind up trying, when I was using it regularly, I often found I could only get people up to maybe 50 milligrams a day, sometimes 100. When you also start getting up to the higher doses, you wind up getting into bone marrow suppression and possible anemia. All right. Now, there were, on occasion, I had a couple people using the lower dose regimens that it is the ticket that got them well. All right. All right. Now, and then the other thing that his initial study showed with lower dose Dapsone, under 100 milligrams a day for an adult, is that there were improvements of about 10 to 15% on average. Out of that, he claimed that people were getting dramatic benefit, and they were not. He overstated what his science shows, and he discounted that 54% of people had to stop using it. Okay. Subsequently, he's come up with a 200 milligram, 100 milligram, a 400 milligram protocol. And the problem with all of those in interpreting his science is twofold. Number one, he's a cheerleader, okay? And he is the person that is he basically makes his findings based on chart reviews that he does of patients using this. So you could always say there's a strong bias to skew any of his results and what he describes as good outcomes in a positive direction. And he is a cheerleader. I'm telling you, he's a big cheerleader on this, okay? All right. Secondly, the problem with his subsequent studies is in any of the data that you read, it looks impressive, like major improvements, et cetera. But his starting point is always based on people that tolerated the initial, that had previously been able to tolerate dapsone. So remember his first study, 50% fell out. That doesn't look that way on his subsequent studies because he starts with people that already could tolerate it at low doses, all right? So we have no idea what his failure rate is on his subsequent studies, or we don't have adequate information of what it would be. Additionally, his latest protocol, the high dose, the super high dose dapsone, whatever you want to call it, basically, Horowitz is a doctor that when he read one study that suggested something might help a person, he puts them on it. So his protocol has people taking so many things that it's really hard to tell what is making a difference. And one of the things he puts everyone on is very high amounts of methylene blue when they get on his high dose protocol to help deal with some side effects that can happen from being on high dose dapsone to help prevent something called methemoglobinemia, okay? And methylene blue is a great germ killer. So if people are getting better on his protocol, is it because he's throwing everyone on monster doses of methylene blue? Maybe. Is it because he puts them on 20 different supplements? Maybe. Who knows? We can't tease it out, okay? So I'm not a big proponent of it. I think there are some people that do get benefits. I myself have not been able to get people to take higher doses. He somehow is able to convince them to do so. And I think his data is skewed heavily because of his own personal biases and also because he just doesn't report any of the initial set of people that fell out of the study, basically, okay? So using it in a kid, I'd be careful. Especially when you get into the bone marrow suppression issues and you get into some of these extra side effects that people can have, okay? I personally would not do it, but you may be working with a provider who has done it with others before, okay? All right. Good luck to you. Hi, Bill. So Bill wants to know, can you share any salient highlights from your dementia conference, maybe at the end? So the big thing I would say, Bill, there was a number of things that came up, but one of the big centerpieces was a recent study that was done looking at what is known as the Bredesen protocol. And there was a research cohort study that was done looking at outcomes. And basically, what this showed is a comprehensive functional medicine approach is probably your best bet at reversing and or stabilizing Alzheimer's disease. That's the outcome, okay? If you wanted to see a copy of that study, I would just look up Bredesen protocol. I believe on Bredesen's site, he now links to the study. I just don't have it off the top of my head. But basically, what Bredesen is basically saying is you want to do things to lower inflammation in the brain. That ultimately is what's going to help here. There were discussions of the fact that one of the things that can lead to nerve destruction and eventually also into loss of brain volume, the development of these tacks, is that your white blood cells in the brain called microglia get turned on and they become inflamed. And so the centerpiece of any dementia treatment is ultimately decreasing microglia inflammation. And it basically is about lifestyle, okay? So number one, it's about lifestyle and metabolics, but the things that seem to help most, and these are all built into the Bredesen protocol, is get sleep, 7 to 9 hours of sleep, it's anti-inflammatory. Okay. Number 2, socialization, having active social community networks is helpful. Number 3, exercising, which can be anti-inflammatory, but also exercising, building muscle especially, releases myokines that help support your brain. Okay. Number 4, is to be on, if you have insulin resistance, you want to be on a ketogenic diet. If you don't have insulin resistance, you have normal sugar levels, just an anti-inflammatory diet like a Mediterranean diet could be helpful. It's anti-inflammatory. Next thing, look at the gut. Do microbiome studies to find out if you have microbiome imbalances that could be inflammatory, because keep in mind, if the gut is inflamed, that contributes directly to brain inflammation. There's direct communication between the two. Okay. Next up, look for environmental toxins like mold toxicity that could be inflaming the brain. Then you also want to look at infections. You want to look at your tick-borne infections and take care of those as well too. Okay. So those are the key parts of a dementia prevention. Oh, last thing. Make sure that there isn't a metabolic dysfunction. So either hyperlipidemia or prediabetes or diabetes. And if there is, you've got to get those under control. So in other words, the way that this conference talked about dealing with dementia was to do it as a full functional medicine protocol. It's just not a pill you take that helps the brain work better, but rather dealing with getting inflammation down in the brain through all of these things, basically. Okay? All right. It's a fascinating conference, though. But anyhow, those are just my quick overtake on it, Bill. Hello, Shanna. Let's see. I have Bartonella. I was bit twice 10 days ago by something. I walked by a lake. Let's see. I took Doxy for 10 days. Was that enough? Why happens if you get bit but already have Bartonella? It burned, slow up quite a bit. Anything else I need to do? So I guess a couple thoughts here. So if you are already on herbal antibiotics or prescription antibiotics and got bit and you're concerned about getting more Bartonella, you're probably covered. You didn't necessarily need to do doxycycline. All right. And just because something bit you does not mean it transmitted Bartonella to you. So I'm not sure I would have done 10 days of doxy. I probably need to talk to you more about symptoms you were having, et cetera. Okay. All right. In terms of doxy being preventive to keep you from getting long-term Bartonella, 10 days may be enough. We don't have studies that tell us about that. Okay? All right. Good luck to you. Hold on here, everyone. Hi, John. Let's see. Hey, Dr. Ross. I've been on Methylene Blue, let's see here, for 9 months, 50 milligrams twice a day. I recently took a 3-week break, and I haven't noticed any changes in my symptoms. I figured that if I was feeling good or benefits from it, I would be noticeably worse off but honestly, I don't feel any different from when I was on prior to taking it. Does that mean it wasn't helping? This was more for Bartonella. I feel more from my herbs. Right now, I'm going to focus on Cryptolepis and try to reach a full dose. Let's see. So make one comment. So Methylene Blue is extremely fat soluble. And things that are fat soluble will stay in your system. In fact, let's see here. I'm going to look something up here. I'm going to look up what the half-life is of Methylene Blue. Half-life tells us how long does it take to get half of a chemical out of you. Okay, let's see here. Okay. So it's got a half-life of about 24 hours, which means it would take a good 4 days to get out from concentrating around your nervous system up in the brain, especially. Okay. Just to make you aware of that. Okay. So if you're only off it for a few days and didn't notice that you got worse, it just maybe you still had some in your system. Okay. But generally, if something is helping with Bartonella, whether it's methylene blue, fluconazole, cryptolepis, cinnamon clove oregano, typically, if you're on a regimen that's helping, usually you'll start seeing some resolution in some, not all, some of the Bartonella symptoms by around 2 to 3 months, okay? And so if you were on it for 9 months and during that time you didn't notice anything, then I would say it's probably not being effective for you. I would also wonder, though, before I would say nothing is working, I would want to make sure there isn't something else triggering inflammation going on in your body, like too many yeast in your intestines or having mold toxicity. I would be looking for other causes that are blocking your improvement. Okay? All right. Good luck to you, John. Hello, Rachel. Let's see. Is there anything special we need to keep in mind if we have Mast Cell Activation Syndrome in addition to Lyme and co-infections, etc.? If we have MTHFR, COMT, SOD, DAO, and a few other generic variants, I'm on a thorough protocol similar to what I see in your guides, but I'm not sure if my doctor is aware of my genetic variants. So, generally, again, the main thing about mast cell activation and treating for these infections is that it makes people so they're just extremely sensitive to things. And so generally, again, I've discussed it earlier, my approach is to do things to deal with the mast cell activation. So stabilize your mast cells, deal with antihistamines. And I have a whole article that tells you how to do that. In addition, for people that remain reactive, I definitely think they should be doing a Gupta program to calm the limbic part of the immune system. Beyond that, it depends on what your genetic variants are. And in addition, not just MTHFR, COMT, SOD, DAO, I would want to look at your whole genetic profile and see, are there other SNPs that counter the MTHFR SNP that you have, for instance? Okay, so it's not as simple as just saying, I've got a SNP here, because sometimes there's other SNPs that might counter or give you beneficial benefits. So I can't say anything about the SNPs. I don't know what the SNPs mean, basically. Okay. All right. The only other thing is, if you are reactive, is work on Gupta method, follow the steps I have about getting your mast cells under control. And some people, when they have this mix of things, we have to go with lower doses of the herbal or prescription antibiotics. I have gotten people well using 1 or 2 drops twice a day of herbal antibiotics, just because that's what they could tolerate, but it still moved them forward and they got well. Okay. All right. Good luck to you, Rachel. Hello, Mary. Let's see. Hi, Dr. Ross. What is your opinion about a positive IgG Babesia FISH after 8 months of treatment with tafenoquine, Mepron, and Zithromax? My physician claims there are many false positive FISH tests. However, I have never seen that in my 25-year experience of Lyme and Babesia. I feel if there is positive FISH, there is an active infection and needs to be treated aggressively. So it's an interesting question. I've been noticing that myself as I've gotten back into practice here, is that I have people coming to see me with positive Babesia FISH test, but when I look at symptoms that might be suggestive of Babesia, I'm just not seeing it. And I need to do some further discussion. I need to give Dr. Shah, who runs IGeneX, a call and just find out what is their experience in terms of getting false positives and how could it occur? I mean, that's one comment. Okay. So I will admit, I've been having a little bit of a question on this recently as well, too. The second thing I would point out is that when we treat these infections, it is possible that we can get people well and not get every germ out of them. What we really want to do is we're trying to create immunologic harmony, right? So it's possible that if we with Babesia or Bartonella or Borrelia, that getting people well means that we basically knock the germ load down enough that the immune system is able to keep it under control or possibly do the final job of clearing the infection. So if I've got somebody that has a positive Babesia FISH, but they're pretty well with Babesia symptoms, I may stop treating because it's not clear to me we need to fully eradicate it. Okay, I just want to be clear about that with any of these infections. The goal is not eradication. The goal is restoring health, because the immune system can police the environment and keep things under control too. Okay, all right. All right, Mary, thanks for that question. Good luck to you. All right, everyone, that's it. It's about 5:30 my time, and I've got some other plans I need to move on to tonight. I've enjoyed being with you here again. I hope you'll take the time to sign up for next week. We are doing another one of these next week. Tomorrow morning, somewhere between 9:30 a.m. Seattle time, my intention, it's my intention, is to get the recording of this out to you with a brief outline of what we discussed and timestamps so that you can jump to the different sections within the YouTube video, okay? If you know other people that might benefit from what we're doing here, please let them know. I'm always open to more people showing up at these webinars. And yeah, and also for those of you that want more direct input, feel free to do one of my education consult visits. I showed you tonight how to find those, but for those, if you missed it, go to martyrossmd.com, appointments, and you could set up a 1 hour or even an hour and a half consult where I'll be glad to just review with you what's going on and answer all the questions that you have. Okay. All right. And I look forward to helping you that way too. All right. Good night, everyone.